ever wondered when a client or a patient is unable to make decisions for themselves, what is done at that point in time? There are a lot of situations whereby you're unable to communicate and you're unable to make treatment decision. Let's say the individual is cognitively impaired, or the condition that has brought the person to seek health care treatment, and the person has deteriorated and the person is unable to make treatment decision at that point in time. What do you think is going to stand in gap in order to make the decision for such treatment? That is where advanced directive comes in. Now, for advanced directive, it is a legal document that is used when you're unable to communicate. Probably you're unconscious or your condition becomes deteriorated, cognitively impaired. At that point in time, you're not able to communicate your need and your treatment decisions and options. Now, how does this work? I already said it is a legal document. Now we have two types. We have the living will and the power of attorney. For the living will, it is like it's a document whereby everything that patient wanted, everything, all your wishes are in that paper. If you want invasive procedure, you don't want invasive procedure, you don't want RT intervention like probably intubation and the rest, you don't want anything like that, you are going to list them. This is what I want in time of incapacitation. This is what I don't want. Everything will be listed in that document, and that is what they will pull out to give you care. It is a legal document, it is backed up. Now let's imagine that probably your spouse is bringing another opinion at that point in time, like, oh, this is what I wanted you to do, full code and the rest. If it does not match with what is in your instructional, it is in your legal, because that was your wish. So it makes it easier for healthcare providers to be able to follow your wish, even if you are not able to communicate it at that time. Now, who is the power of attorney? Power of attorney is who you have legally chosen to stand for you when you are unable to communicate or to make treatment decision. Now, for power of attorney, do you think it has to be the spouse of the patient, or do you think it has to be like the children, like the firstborn child? No. It all depends on who the patient wants. So if the patient wants the wife, fine and okay. If that is who is appointed, that is the person's decision, they are going to follow at that point in time. But if that is not who you wanted, you can even pick your neighbor. Power of attorney could be anybody. So the patient could pick their neighbor. And whenever people are admitted in the hospital, they usually have them. Do you have an advanced directive, or do you have a power of attorney? Like, you have an advanced directive, so you are going to bring like the document that is stating your power of attorney, or that is stating your that is having your instructional and living will in it. So that is what they are going to follow. So if at a point your spouse is saying, no, I don't want this, and the power of attorney is saying, this is what I want, so they are going to go with the power of attorney. Probably if there's maybe ethical dilemma, they could call the ethical committee, but most of the time the power of attorney decision stands, because the patient has said, this is who is going to take charge, and this is who I want in this kind of situation. Like, when I'm in this situation, this is who is going to stand for me. I believe what that thing means is that I believe this person is going to make the best decision for me at that point in time. Thank you, and have a nice day. All my attempts to make this video shorter did not work.